Okay. Okay, Jeannie seconded the minutes. All those in favor signify by saying aye.
Aye.
Opposed? Motion carried. Okay. So, right now, we have on the agenda the closed session. Now, I heard some,
There's,
make a
Let Jeannie start.
motion? Or
there's a request from the TV station that it, closed session be at the end of the meeting. It's less complicated because we're public now, and then we're gonna shut down, and then we go back again. But if we can't, we can't. So it's up to you. I don't even know what the closed
So
session
the
is
pros and
about.
cons for your consideration is, one of our committee members, Mr. Nimitz, will not be here until 4:30. On the other hand, our next speakers are going to be delayed because we thought there'd be a closed session. So, it's your call how you want to handle this.
Rick, what do you say about that?
I'm gonna leave it to the committee to
Okay,
decide
okay.
how they wanna do it, so.
All right.
So we need to make a motion then?
Well,
Either way, or we just,
I mean, if you don't change it, of course, you don't need to make a motion. But
Right.
If you do, then yeah.
yeah.
So you made a motion, Jeannie?
I can't because there's no approve the agenda on the meeting, on the agenda.
There is,
So I can't change the agenda because we don't have a thing on here to
there is
approve the
none.
agenda.
You
Can I do it anyway?
You can do a motion to lay it on the table until after a certain item on the agenda and remove it from the table if you'd like to at that point in time.
Oh, God.
This got really complicated. Yeah, or we just.
Well, if it's going to be a problem for people coming that expected at a certain time, I don't know.
We'll do it this, how about this, in the future, we'll always make sure we put it at the end.
Okay, I'll go tell them that.
Okay.
All right.
Okay. The agenda item will stay as it's put in the agenda here. Okay.
So we'll need a
I'll
motion.
wait till she comes back. Or if, we can move ahead here and ask for a motion to go into closed session.
I'll make a motion to go into closed session per Wisconsin statutes, Section 1985, Parent 1, Parent G, to confer with legal counsel for legal advice with respect to litigation in which it is or is likely to become involved. I'm guessing the county to become involved.
Second to that motion? Okay, roll call vote. Karen?
Yes.
Dora?
Nutter,
Judy?
yes.
Miller, yes.
Kelly, yes. Did we get anybody on?
Michelle is not on.
No, and I'm yes, so, okay, we're going into closed session.
If you have any questions, we'd be happy to answer questions.
Discussed in closed session if needed, and worth nothing to discuss, I guess, so. We'll move on to number 7, Economic Support Program presentation.
So, economic support, microphone on, Deb. So, economic support has made some changes during COVID because of individuals, it being difficult to come in and provide documentation of things. And so, the state of Wisconsin, along with the federal government, have made some changes. But we're going to be reverting back to the old way of doing things sooner than later. And so, that's going to create an enormous workload for our staff. And, do you have more napkins?
Yes, I didn't want one.
Oh. Oh, okay. Thank you. Anyway, Sandy and Dana are here to talk to you about, to give you kind of a heads up about what we're going to be seeing for some workloads for our economic support staff. So I'll turn it over to, I'd like to introduce our Economic Support Services Supervisors, Dana Lee and Sandy Pilkowski.
All right, thank you. So, like Deb mentioned, we have gone through many changes through the COVID-19 pandemic and economic support. I'm just going to touch on some of the high points. So, for anybody who's been eligible for medical assistance on or after March 18th of 2020, they have had their health care coverage maintained and will continue to do so throughout the remainder of the emergency period. For our individuals who are receiving community waivers Medicaid or institutional Medicaid, it also prevented any increases in their monthly cost shares or institutional patient liabilities. People who lost their jobs were then able to obtain health care coverage through medical assistance. So when they return to work, they won't be losing their health care coverage until the end of the emergency period, which has provided additional economic stability for families in need and when beginning their new employment. For food share, we've also seen a lot of changes to that program during the pandemic, including the issuance of additional pandemic food share. Additional emergency food share allotments were issued to households who were eligible for food share benefits. We also had PEBT benefits, otherwise known as Pandemic Electronic Benefit Transfers, which were issued to households with students who are both eligible for free and reduced lunches and attend school virtually. The food share benefit in the month of March of this year was $7,297,284.42 across the Western Region Consortium. $638,900.23 was issued to our Trempealeau County residents. These extra food share allotments were not only benefiting those in need of nutritional food, but it also helped to support our grocery stores and our local convenience stores financially during the pandemic. In addition to these changes, there were also some verification requirements that were changed. They were minimized, in fact, in an effort to remove the burden of verification for eligibility of the programs. And there have been many program requirements that have also been waived during the pandemic. So this has made things a little less difficult for individuals to become eligible for our food share and healthcare programs. And as a result of this, economic support has realized an increase in about 5,000 cases across the consortium. So now I'm going to turn things over here to Sandy to give us some updates about the Child Care Assistance Program, as well as provide us some more current updates that ES is seeing and the impact on our workload.
Thanks, Dana. So for the child care program, when the pandemic started, child care renewals were extended 3 months. So an example, in March, if a child care renewal was due March of 2020, these renewals were pushed out to June of 2020. DCF only extended the renewals one time for this program for the months of March through June. So the renewals that were due in June that had been extended from March had to be completed in June of 2020, with an interview being completed for that renewal. DCF did implement some of the reduced reporting requirements for the child care eligibility, which have continued to remain in place for those members. Starting in July of 2020, child care applications and renewals were again mandatory, and interviews were being completed for that program. One of the temporary processes during this pandemic that has helped some of the members continue with eligibility is the child support non-cooperation. What that means is we are putting in a temporary workaround, so if someone has to complete and cooperate with child support, we have a temporary workaround that we enter so their eligibility begins for that program and they can continue to work. That case will remain in that status for 60 days when a report is run, and then we begin to work those cases for that non-cooperation. At that time, the household member either must be participating with child support or have good cause for not to participate, which we would then verify and work with the household on that. Starting March of 2021, families with children 0 to 3 years of age started receiving a 21% increase in their Wisconsin Shares subsidy. With the increase families received in this subsidy, Western Region households were issued $323,850.88 in Wisconsin Shares subsidy monies. Trempealeau County families received $19,062.02 in those subsidy funds in the month of April. Some of the current updates, changes that we're going to start seeing in the Economic Support Unit is an increase in healthcare applications. The federally facilitated marketplace extended their enrollment period to August 15th of 2021 for marketplace coverage. Any applications that are found to be potentially MA eligible are also sent to the Economic Support Unit to be looked at for eligibility for the Medicaid Assistance Program. As of February 1st, 2021, DHS reinstated the normal Medicaid rules for patient liability and cost share calculations and increases. The purpose of this change is to minimize disruption to enrollment in these programs and prevention of individuals being over the program asset limit at the end of the healthcare emergency. The Federal Department of Education sent communication to our college students with expected family contributions of $0. As a result of this, we have seen an increase in the number of students who are applying for the food share benefit across the consortium. In addition, some of the waivers that previously were implemented are now starting to be required, including the 6-month report forms for food share and food share renewals.
Thank you.
So what this means for us is that there's going to be some major changes. There's going to be a lot of renewals coming through that we haven't had. We have trained 2 staff since COVID started. We had another 2 staff that were in training when COVID started. And so we've got over half of our staff, just the Trempealeau County Economic Support staff, they're going to have to be trained, almost completely retrained on how to do their jobs. And we're going to see a lot more applications coming through. We are, of course, as you recall, part of the 8-county consortium, and that what's going on in our county is pretty similar to what other counties are going to see. So Trempealeau County cases may be processed by La Crosse County staff or Clark County or any other member of the 8-county consortium. And so you may be hearing from constituents saying, I'm not getting benefits I was getting before, or I'm having a hard time getting a hold of staff. We're hoping that isn't the case, but the workload ahead of us is a pretty big mountain, and we just wanted to give you a heads up on what that's going to look like. Anything else I need to add to that? Yeah, Sandy and Dana do a phenomenal job. I also want to brag that we are the only county in the consortium other than La Crosse County that has 2 supervisors because we have such talented staff here. So I just want to say kudos to those ladies.
You guys are awesome.
Any questions? Thank you.
Thanks, you guys.
Go on to number 8, approve voluntary
Yeah.
kinship wait list policy.
So Sam is handing out documents on that. Here's your copies, Kirk.
Okay.
So these next 2 policies that are on the agenda here are requirements from, I'm missing a page here, sorry. Are requirements from the state. The first one is the kinship program. We have, 20-ish, how many families do we have, Sam? About 20? That have the kinship. Kinship is different than foster care. Kinship was created when they created W-2 a long time ago. It's a way for aunts, uncles, grandparents to be caregivers of kids. They get around $256 a month, $254 a month to take care of a child that's not their own. And unfortunately, we don't have enough resources to spread around to everybody that would be eligible for this. So the state is requiring that we have a process to set up a wait list. We may occasionally have a family or 2 on a wait list. Again, we try to get them served as soon as possible, or if they're on the wait list, we try to give them some other resources. But the state really wants us to have a policy. So that's what this first policy is that you have. And the second policy is another children and families. I'm just going to kind of put 8 and 9 together. The second one is for foster parents. They have to, by federal requirements, we have to actually, it's the Adam Walsh law, we have to fingerprint the foster parents. And collecting that information is technically called Criminal History Record Information, CHRI. And there are some very strict provisions on how we protect that information. And so this policy is about how we do that. So that's what these two policies are about. Yep, Kurt has his. So that's what these two policies are about. And Erin Herber, who's the supervisor for that unit, had a family obligation, so otherwise she'd be here to talk about it. And I'll answer any questions you may have. So we'd be looking for a motion to approve each of these.
Yep.
You want them, a motion one at a time?
Doesn't matter to me.
I'll do them one at a time. I'd make a motion to approve the procedure and policy for, oh, these are both the same, no? For, oh, no, I'm sorry, for the
The
kinship
tops look the
care.
same.
For the kinship care wait list.
So for the kinship?
Yep.
Okay, second?
Somebody second. I did. Yep, I got it.
Okay, Sally, second, okay.
You're missing some words
Oh,
here. Like in the first sentence. Maybe after to provide direction to develop a wait list or.
oh, for a wait list, yes.
Yeah, that, and then I think maybe in the fifth paragraph, middle line, based on a first.
Come first served based on the date. It reads kind of
Oh,
funny.
it should be first come, first served basis.
Yeah,
I'm better at numbers than words, sorry.
that's okay. I'm the words girl.
Okay. Motion and a second to approve the policy for the
Do-
kinship care wait
Do the
list
motion and second, are they okay with the changes that Karen mentioned?
Yeah.
with the changes, sorry.
I may have missed this because I was reading this, but there's not currently a wait list for kinship care.
No, that's, we need to,
And I.
we're
and
to
I'm-
the point where we need one, and that's
Right.
why we have to do this.
Right, but I also understand in reading this, if the court orders a kinship placement.
We don't
for
have a
child,
choice.
You don't have a choice. Okay. You know how much I hate wait lists.
Yes.
Everybody understand the motion?
How many
Okay.
kids do we, I'm still asking questions, I'm sorry. How many kids do we have in kinship care right now?
About 20 cases.
Is the wait list financial?
Yes.
I'm slow in processing, I'm sorry.
Yes, it's a financial, that's what's causing the wait list, the
Okay.
limitation of the finances. We do try to find other ways to support those families. If it's eligible, if the kids have any type of disability, we may make referral there for CCOP or, any of those types of programs. So we do try to find ways, if they have to be on a wait list, we try to find other ways to support that family than to just leave them hanging out there.
Okay, so there can't be any more voluntary kinship placements if there's a waiting list. They will all have to be court ordered.
Correct. Until a family leaves or we get more resources.
Okay.
Any other questions? Not, I'd look for a motion to approve. Okay. All those in favor signify by saying aye. Opposed? Okay, carried.
So we need to give you more money.
Yeah, we can.
Kinship all comes from the levy, correct?
No, we get kinship, there's a grant about
Oh, there is?
40-ish, 40, depends on each year, it's a little different, between $40,000 to $50,000 a year we get from the state.
Oh, well, they should be
Okay.
giving more. So they're
That's-
not in foster care. We want them in kinship care.
Okay, move on to
Okay.
number 9.
Sorry.
You want
So
to,
number 9 is, again, the protection of this, protection of that fingerprinting information that we get as a requirement of the Adam Walsh fingerprinting requirement for the foster care licensure. And it's just talking about how do we protect that fingerprint information. Actually, when I worked at another county, we had to create the exact same policy, so we just are a little bit behind the times, so we just got to get this approved.
I'd make a motion to approve the procedure and policy to protect fingerprint information for foster parents, which is a requirement under the Adam Walsh background check.
Thank you.
How do you currently keep it? Well, I'll ask that question when we're done here.
Get that, Sam, I said.
second to that? Okay.
So how do you currently keep,
We have to have it all locked, we follow all of it,
Okay.
we just didn't have the policy to go. We have the practice, but not the policy.
okay, all right, thank you.
Okay,
Hasn't
motion
it-
made and second.
have
All
a lot
those
of
approved
questions.
signify by saying aye.
I
Opposed? Carried.
appreciate the questions, thank you.
No, but does anybody ever ask for this information? Like law enforcement, I mean, would law enforcement not be able to get, well, they do the fingerprints.
Right, we
by
get
and
it
large.
from
Okay,
law
all right,
enforcement.
Never mind, I'm good.
Okay. Number 10.
Melissa Youngbauer is going to join us for the next few items. I just messaged her a little bit ago, so if you want to message her again. While we're waiting for her, if you don't mind, we'll just jump to number 14,
Personnel
13?
report.
13 or 14. We can do 13.
Oh, here she is.
Oh, here she
Budget
is. We'll
update.
just jump, we'll stay in order. Yay.
Perfect timing.
So, the ADRC advisory, recently you approved a few additional members. I misread the requirement. I was thinking it could be 12 members. It's 12 members plus a member of the Human Services Board plus a member of the county board, so that's 14 members. So we are short some members, plus we had a resignation. So we need 3 members. Melissa Youngbauer, our new ADRC Services Supervisor, has been in the job for a month and has been going to town like crazy. Melissa, do you want to provide a little report on what you have for recommendations?
Yeah, okay, as far as the advisory council?
yep.
Yes. So we have 2 slots that are open right now. We did have Alan Robertson from Blair, who has just accepted a spot on the council.
So we'll need this body to approve that and then advance it to the county board.
Okay.
There's 2 other slots that Melissa's working on. She got a maybe this week from
I
somebody
actually
that.
got another maybe this afternoon.
So she has 2 maybes.
2 maybes.
Which is more than we had a month ago. So she's getting us advanced here. So we'd like to be able to get Alan Robertson. I think many of you know him, a local attorney.
Motion to approve Alan Robertson to the ADRC Advisory Committee.
So moved.
I'll second.
Second. Motion second.
And the other 2 individuals that are considering, I have sent them the bylaws and the orientation guide, and
So next
they have a
month-
week to consider.
So next month, we'll bring you, if we have their names, we will bring, hopefully we'll have 2 names for you again. So just so you understand why you're getting this piecemeal, we have a meeting next month. We want to be able to have as close to a quorum as possible. And so again, filling up that membership with people that want to be actively involved is
Right.
important. And I know, Jeannie, you're on that body,
Yeah,
so
who's the other county board member?
Beth Killian.
Oh, that's right, that's right.
And yeah, I'm glad that both of these other potential persons are, taking time to consider and wanting to make sure they have a strong interest and know what they are getting signed into.
And by resolution, we have to find representatives of certain populations, which is why the last 2 seats are a little bit more difficult to fill, because we want to make sure we get people that represent those populations.
We had a quorum last month. so-
We had a quorum of, yes, so we want to be able to keep that, because we didn't have one for like a year, so.
Well, COVID kind of slammed us.
Right.
Yeah, they did.
Right.
So this motion is just to move it on to the county board for approval?
Yes.
Yes.
Yeah. So
Sorry.
all those in favor?
Aye.
Moving it on, okay, all right. Opposed? Carried. Approve the reissuance of senior nutrition program Congregate.
So
RFP.
Sam handed out,
Oh, wait.
Melissa should get a copy, or Sam
Oh.
has a little report that says nutrition program bid summary at the top. This looks a whole lot like a document you received in November when you looked at nutrition bids then.
Oh, they're not? Okay.
So, Melissa can fill in the blanks here, but when we received the bids, because we do a 3-year contract, so last fall was our 3-year cycle, so we put the bids out, and we got a number of providers, oh shoot, it says home delivered providers 18 to 20, you can cross that off because it should just say home delivered providers. So we received a home-delivered meal providers. We actually added one this past year. We added, or for 2021, we added Rainbow. And you can see the rates that they have. So that program is in good shape. But what we received very few bids on was for our Congregate meal site. And we did get a bid from Rainbow Cafe. We got a late bid from Boondocks. We did receive a bid from Dove, and I'll explain in a minute why their box is in gray. And then, of course, we have the Pine Creek twice a week site that we operate. And so last fall, we agreed that Rainbow, Boondocks, and Pine Creek would continue to, in 2021, would continue to operate a carry-out type of meal. We did not agree to that for Dove because their attendance had been only 1 or 2 people consistently for a long period of time. We did a number, when Erica was ADRC Services Supervisor, we did a number of things to try to get people to go to the Dove site. It has been difficult, and so we didn't feel the need to accept their bid at this point. What was discussed last fall was we received so few Congregate meal sites because we had other sites throughout the county. We also recognized that with COVID, it was difficult for a lot of these small restaurant-type facilities to have any idea in November what they were going to look like for the next 3 years. And so we said we would bring it back to you in spring to get your permission to re-RFP for additional Congregate meal sites at that time. I also do want to tell you, Boondocks bid, their bid included 5 days a week. We have accepted for the pickup program until we got additional bids, 3 days a week. So that is a difference from their bid, that they did offer 5 days a week. We're just doing 3 days a week with them right now because we thought it'd be easier to start with 3 days a week, which is what they had been doing in the past, than to give them 5 days a week and then get so many bids from so many places and make them go down to 3 days a week. We thought it was just easier to start with the 3 days a week. So that's what has been approved. And so we're seeking your permission to re-RFP. The timeline, do you have that, Melissa?
Yes, the timeline, we would hope to send out the RFPs this week. And what we would be asking for would be a deadline of June 2nd at 3 p.m. And then we would open the bids beginning at 3:30 p.m. on June 2nd. We would then meet with the advisory council on June 8th, and then this board again would be June 14th.
And then we'd be looking to go have Congregate meal sites open, these additional bids, open July 1st. The other item number 12 is related to this, so I just want to explain that, but it is a separate discussion item. Of the sites that are open, Rainbow, Boondocks, Dove, which we haven't done anything with, and Pine Creek, do you want to open them sooner than July 1st or not? So I want you to know that that question is coming up because you may have that question in your mind as you're deliberating all this. And so that's a separate question. But the question today is, can we put out the RFP with the timeline to seek additional bids for Congregate meal sites throughout the county?
So you're looking for a motion?
Yeah, we have to officially get your approval to do that.
I would make a motion to reopen bidding for Congregate meal sites with bids to be submitted to Human Services by 3 p.m. on June 2nd.
Thank you.
A second.
Okay. I pull the mask when I can't,
Oh, I'm sorry. You want me to repeat my motion?
yes.
My motion is to give the Department of Human Services the authority to reauthorize the RFP, is that the right word?
Reissue.
Reissue the RFPs for Congregate meal sites with bids to be in the department by June 2nd at 3 p.m. and bids will be open on June 2nd at 3:30.
Thank you.
Okay, everybody on?
And Sally
Rick?
seconded.
Question I had, will the Boondocks be offered 5 days?
So the plan, it's your choice how you want to proceed. The plan was we would, once we get the bids and determine are there other places that are bidding, where are they? And then based on that, we could expand, we could either open Dove and and honor that bid that we received earlier, and/or we could provide additional days to Boondocks. So we could do that at that time. If you want to do that at another time, that's certainly your prerogative as well.
I guess if they're offering you a service and they have the demand of, I don't know how many meals a day are they serving, any idea?
I don't know that off the top of my head. When they were open, like pre-COVID, they were serving around anywhere from 15 to mid-20s in meals per day.
And is that standard, is that high, low?
Erica, do you remember?
That they're, I would say, right in the middle. They're not our highest attended meal sites. That was always historically, that was Rainbow and the Sunflower Cafe. But Boondocks had a strong showing. I will say, Boondocks, I know Mary has requested additional days in the past, and we're not necessarily opposed to that. Some of the concerns we've addressed in the past include there's some required trainings and things that are mandatory per the meal program for us to get federal dollars for this. And they have been a little more difficult in getting to attend and participate in some of the requirements of Chapter 8. So those, we've also had more, I mean, we were kind of maxed out on congregate meal sites in the past. So I'm not saying you should go one way or the other, but that's some of the rationale behind why decisions were made the way they were in the past. And we've had more congregate meal sites historically in the south than we've had in the north.
It's part of the decision is where we have Pine Creek, which isn't that far from Boondocks, and then we have Rainbow. So again, we have 3 sites open in the southern half of the county. We have nothing in the northern half of the county. Part of our job is to provide some equity throughout the county. The other issue that we had is that they have been historically and continue to be our highest priced site. And so, again, that's another reason that we have to take into decision. That's the reason we've done it. It's not a reason we can't change it. I just want you to understand why we've done it.
I understand that, but why should the seniors continue to get the short end? You know, they supported
And
a ton of people when they were in the workforce.
Mm-hmm.
Now,
And this board, I will say, and Jeannie can certainly speak to it, this board has been very vocal about not having waiting lists for seniors for meals. So providing numbers of meals is something that's been near and dear to this board's heart. So I'm just telling you why we made these decisions or recommendations. The ultimate decision is yours. If you want to make a decision to open the Boondocks from 3 days a week to 5 days a week, and/or open the Dove site, that is certainly your prerogative. They have bid, and that is certainly your prerogative to put that on the table.
I would like to wait until we see what other bids might come in, because I know when Pammy K's was a lunch spot, nobody went. Dove, maybe 2, if that. Nobody went to Dove. I don't understand what's going on in the north. Maybe they all go to Rainbow, because Rainbow, pre-COVID is fun. There's a lot of people there.
Too many quick food places up there.
Well, and I do think we really hoped Dove, we did a lot of work with Dove because Dove truly wanted to create a community type environment there. I do think that the public struggled with that. So we kind of had to learn from that they really did not want to go in there. We tried everything. We provided rides. We did all sorts of advertising. Dove was awesome to work with. They did activities surrounding the meal. And it just clearly the public, I guess, spoke in terms of not going there, and so we realized that wasn't working. But that was one reason, we did a lot of work at Dove.
We all ate
And
there.
I partially feel, and then COVID changed the whole game for them. I mean, that was one really awful thing because they are a nursing home. It really, really restricted what they were, they couldn't have people coming in. So that was kind of we put a lot of effort into that. I mean, there were a lot of meetings with us and Dove and a lot of great things that went into that. It's just the public never really wanted to go there.
Food is so
It was very good food, yes.
spectacular. So I don't know what the problem was. Same with Pammy K's. Food's great there, nobody went.
the question I have is, is that I don't consider Rainbow in the southern part of the state or the county. They're in the center. Where is the where's the senior population? There's nothing in Trempealeau. Trempealeau's got 1,900.
True.
The town of Trempealeau's got 1,900 residents. They're not all seniors, but I feel there's more population there than there is on the north. That's my opinion. The other thing, people go to the boondocks for breakfast, seniors. They sit there, they have their breakfast, they go home, they come back to get their senior meal. They can't eat it there, but they can eat their breakfast there. It doesn't make any sense.
That's why we have the second item on the agenda, and
Why
that's,
can't
I
they
think
eat
your
there?
point is,
Because it's carry-out.
because
because of COVID.
Because of COVID, the county, and Melissa can speak to it more than I can, but there are very few counties that have opened up meal sites. Washburn has opened up meal sites. There's a few of them talking about opening up meal sites. I definitely get the sense, even before Rick called to talk to me about this agenda item, that we received a request in January from an individual who said, can we just open up the meal sites then? So that's the reason that that's the reason.
I'm all for opening them up July 1st.
What about Jackson County?
I'm not familiar with what their meal sites are. I don't.
They're still doing carry-out.
I believe so
Jack-
too. We do have to actually get permission from the state in order to open them up. I do know of Washburn. I believe that was the first. There may be a couple others that are in process. I've seen some of their plans, but to my knowledge, I believe Washburn's the only one that is currently open.
Pardon my pun, but this county has an appetite for opening the meal sites.
But I stopped in Taylor and had lunch. It was about the gal at the cafe, and she says, I had whatever their special was. She says, you can come here at lunchtime and eat your meal for $4. We have a senior program.
They're doing that under the table. There's a lot of restaurants that do that. I'm not saying there's anything, I'm not going to say anything about that because we're bound to follow the rules to get the money. The feds and state oversight us to say you have to follow the rules to get the money. Now, what the restaurants do, is when we're not there, is what they do when we're not there.
Well, and Washburn has a plan. We got that information from Melissa at our ADRC meeting. I would not want to be we get a lot of money from the feds. Well, it's not a lot, but we get money. So I would not want to harm that relationship in any way by opening, and I don't know if a person over 60 has been vaccinated. That's a high-risk population. There are a lot of people not getting vaccinated in this county, so I worry about our seniors being exposed.
Melissa pulled a report for the ADRC, if you recall, and we had 80-some% of our senior population had received their first vaccine. That was a month ago, so I'm sure it's hard. But you're right, not everyone has. Also for your information, the RFP does include all the information from Washburn about the requirements that people would have to be able to dine there in order to comply with all the COVID requirements from the state. So that is in the RFP as well.
Okay.
I will say I have had the opportunity to meet with both the Rainbow Restaurant and with Pine Creek. Both of them are indicating that, yes, they're wanting to open as well as Boondocks. So, and when I was at at Rainbow last week, it certainly is a thriving, booming place. There's a lot of seniors that are continuing to go there and just ordering off the menu and doing that on their own. So if you were to go in there, one might believe that the congregate dining is open. However, it is not. People are taking carryouts.
So to clarify, there's two agenda items. One is to approve RFPing. The second one is to discuss opening the current site. So those are two separate items that we can discuss. The question about offering or accepting Boondocks bid to be 5 days a week is something you could certainly add to this conversation about the bids and the RFPs, because they did respond to the RFP with that request.
The only reason I worry about their going to 5 days is that they're so expensive. And you know, I'm not gonna, we have a policy for a waiting list, but we've never used it, and I hope we never do. But that's a lot of money.
I still believe the seniors deserve it. If
They do, that's why-
If we can borrow $43 million to build a justice center, you ought to be able to provide your seniors a noon meal.
We did get more money from the we fought for it, you know, but we're not high in the priority list, and I speak for myself as being nearly 70.
Rick, would you like to add that in on one of those two?
Well, let me just add this comment budget-wise in all transparency. So obviously, with fewer congregate meal sites open, or not open, no, none of them are open for the public, none of them are open right now, but people can pick up at some limited meal sites. We are certainly down on our numbers for congregate meals compared to what we normally would be, and we budgeted for what would have been a typical year. So for 2021, if we gave them 5 days a week, we would probably be okay, depending on what we get for other bids. The issue will be for 2022 and going forward. We will, if they go to 5 days a week, and assuming we do get some other bids, again, there's assumptions built in here, so it's a little hard for me to answer exactly how, should they go 5 days a week today, or should we just wait till next month and make that decision? It's a little hard because I don't have all the information. But next year, we will have a budget problem, assuming we get a typical number of people going to meal sites with a typical number of sites open. So that we could afford it this year, but next year will be a budget problem. And that I do, so then do we get, then we'd have to ask for more money from the board. There's no guarantee we'll get that. I guess that's my point.
It would be helpful if Boondocks came in with a more competitive rate, if anybody's got any negotiating skills.
Well,
Well, we're in a contract right now with them, so I think we're stuck with that. So, Dora, did you have something to add?
Well, what I wanted to know, with this COVID, did we have a lot more going on the home delivered meals, or did that?
Meals on Wheels, you mean, or whatever?
Yep, home delivered meals. We did see an increase in that. I can't remember exactly the amount. It was higher initially. I think it's tapered off a little bit.
So
Is
there's
that about
probably
right,
some of
Melissa?
them that haven't come back.
Right.
And then Pammy Case, she's not doing evening meals now, is she?
She did not bid last fall, but again, neither did anybody. We had received requests from other potential restaurants last summer and said, put us on the list, we're going to be interested. But last fall, when we did these bids in November and December, was right when the COVID was spiking. And for these little restaurants, I don't know if they even knew if they were going to survive COVID. So I think it was hard for them to bid. And that's why this body agreed that we would come back in the spring and allow a reissuance of the congregate meal sites.
Well, and I think there is one tavern in Oliva that, I don't know if it's more than once a week, they offer these $1 hamburgers, and I guess they really get,
Flying Ryan's?
it's the one north of,
Oh, Flying Ryan's has 2 for $1, but they were also shut down 4 times during COVID.
Is there a possibility we could offer the Boondocks 5 days to be reviewed at the end of 2021 to see whether you can afford it or not afford it?
That is certainly an option that this board could do. It's your call. If you want to do that, you can. I just, in transparency, I wanted you to know that we could afford it this year. But next year, again, depending on the bids we get, if we get a typical number of sites open and we have a typical number of people attending, we will have a bit of a budget crunch. And you could review it at that point and make a decision if we go back to 3 days. Again, it's sometimes harder for an organization to go smaller than to get bigger, but it's your call.
Because who knows, we're assuming we're gonna get a lot of bids.
We might.
And you may not get,
You're exactly right. You are
So-
exactly right. It is.
you have a sure thing
I did talk to one restaurant that had been interested about a month ago, and they said with the price of meat doing what it's doing, it's really hard for us to put in a bid for the next 2.5 years. So it's possible we might not get much for bids.
And Pine Creek is not a busy place. I mean,
Oh, they're pretty busy.
oh, they are?
They're pretty big.
They do about
That's
20,
changed then,
they
because-
do about
Okay,
25 to
good.
30
That's
meals
good,
typically.
Because a couple of years ago, it was pretty slow,
No, that,
before COVID even.
poor Melissa's microphones.
We've been muted.
Pine Creek is not
What?
doing.
What's the matter?
Pine Creek has been at about 20 for both Tuesdays and Thursdays. So they've actually seen an increase. It's, yeah, with the carryout, yes. So,
Well, we have the motion, so.
You had a motion now for the-
Somebody amending the emotion? Emotion.
You,
I'd like to amend it to let Boondocks have 5 days for 2021 to be reviewed at the end.
That should be a separate
yeah.
motion then.
Are you suggesting that in lieu of the RFP?
you made the motion on number 11 here, is that it? Ginny?
Yeah, that's to
Again-
extend, mine is just to extend the RFPs until June.
I think you can
2nd.
make a separate motion under this same topic because they're both about the RFP, because it's really about the Boondocks response to the RFP.
You want to amend the motion, is that it?
No, I think two
No,
separate
it's gotta
motions
be a
would be okay.
Okay,
separate-
we'll make a separate motion. Okay, now did we get a second? Did you second
Sally.
that?
Yeah.
Oh, you did. It was a long time ago.
Yeah, it was. Okay, motion and seconded for the approval of the Senior Nutrition Program Congregate RFP. All those in favor signify by saying aye.
I,
Opposed? Carried.
Any other
Okay,
motions?
then we'll add your motion if you would like to make
I
it.
would like to make the motion to allow the Boondocks 5 days of meals for the 20.
For the rest of 21.
Congregate meals for 2021.
2021.
do they want to do 5 days?
Yes.
Yes.
Everybody understand the motion? Second?
So who is this now that
Who
wants
seconded, Sally?
Are there
Okay.
questions?
Well, I had a question, so, through the end of the year, and then look at the numbers, would you need to have this kind of figured out by September, October, November budget time?
August budget time, yeah.
Okay, so,
So again, we'll have to look at what the RFP brings and what the attendance is going to be, and we'll have to make some projections based on that.
Okay.
But they'll be allowed to serve through the year.
yeah, just,
But they may.
yeah, because if we come in February or something with a budget change, that's working
Yeah.
cranky.
The other thing we could do is we could say with this motion that they're approved through 2021, that they should not make any assumptions for 2022. We'll put in the budget, we'll ask for additional resources for 2022. If they come through, that great. If not, then we will go back to what that is. That would be the expectation.
So maybe, subject to full board budget approval,
Yeah, that would be,
2022.
2022, yes. And that-
The next-
Because
for-
we can always
for
introduce a budget
2022,
amendment
yeah.
on the floor.
We'd be all right this year from our
November hearing,
meeting.
right. So by
Okay.
the November hearing, we probably have a pretty good idea.
now
Okay.
bear in mind, you're going to have a lot of people that attend that are going to say, how dare you cut it back to 4 days or 3 days a week, because I've been going 5 days a week. So that's a little bit of the can of worms you open. Not a reason to not do it, but I just want you to be aware of kind of how that process works.
How many people actually, what's the average at Boondocks per day, for takeout right now?
Between 20 and 25.
I thought it was between 25 and 30.
Oh, maybe it's a little bit
Yeah.
higher now, okay.
Mhm.
That's a lot of money. I'm nervous about this.
You know what, I actually listening to you, Rick, I'm like, why didn't they bid on breakfast? I mean, a senior meal site for breakfast would have probably been a popular
They
thing.
probably make more off the regular menu.
Oh, true.
Everybody understand the motion, approval? All those in favor signify by saying aye.
Aye.
Approve? Okay, carried. Okay, then we'll, the discussion on reopening congregate meal sites, which you have done.
No, Is there any interest in opening the current meal sites prior to the July opening when the other ones from the bids open? Do you want to open these sooner, or do you want to continue the carryout until July 1st, or would you want to open them sooner? That's your call.
Do we even have the authority to open them without?
With your recommendation, Melissa and I would contact the state and seek that.
And I would like, if we do that, I would like us to look at what Washburn County did, so there are some safeguards.
And yes, we are definitely sharing that with everybody. So that's a great point. So if there's a motion to open them sooner, otherwise we'll.
I would like to move that we open June 1st if we can, as soon as we're able. With that,
That's
I'll
like
just make
2
the motion.
weeks.
Let's just start there, and then I got something to say.
The state doesn't move that fast.
Well,
That's in 2 weeks.
And what's the point of June to July?
Well, it gives the
I
county more time.
think you can make that motion
The
and
state
we'll.
does for long-term care. They can make it in about 2 days if they want to.
Just as soon as possible.
Yeah, I think you just say June 1st or.
As soon as we're able to.
I'll second
As soon as
that.
possible with the approval of the state.
Okay, as soon as possible with approval, say, thank you.
I'll
Karen,
second
you made
that.
the motion to,
Dora Jean seconded.
Dora, you seconded?
Yes.
Okay, all those in favor signify by
Oh,
saying aye.
there were questions. Was there a question? Or Karen, you were going to add something?
Well, I was just going to clarify that, I think the purpose is it's really good for people to be out, and our seniors are desperately trying to be connected to people. So I think as soon as we can get it done within the regulations, we should go for it.
Okay.
As long as it's safe.
I think most of them that want to get out probably have already
Oh, for sure.
taken their.
I have
gotten their
not set
vaccine.
foot in a restaurant
Yeah.
for over a year, I can tell you that, though.
Okay.
Lot
All
of
those in favor
carryout.
signify by saying aye.
Aye.
Opposed? Carried.
And by the way, the state will require, we know from what they've done with Washburn, they will require that if they open, that they will also have to offer the carryout. So for folks like you, Jeannie, who are not comfortable going into a restaurant, you could still go to that meal site, get that meal, but not have to dine there. Thank you for saying
Or eat
that.
outside. I ate outside in Galesville at the Garden of Eden until December.
Okay.
State budget update.
Budget update.
So, Joint Finance met last week. They pulled 200-some items from the governor's budget. The ones that pertain to us, probably the most significant is the youth justice, where they were going to really transform the entire youth justice system. They pulled that piece of it
The entirety?
entirely.
Oh, God.
So there will be certainly discussion about, because we talked with, Eric and I talked with Representative Brzezinski and James last month, and then later that week, Representative Brzezinski came back and talked with several of our staff about some of the issues to get some more detail on some things, how they pertain to Trempealeau County. And I definitely got the impression from them that the legislature agrees that an improvement needs to be made, but the way that it was put together by Department of Children and Family Services without any consultation by counties was problematic, and that if they were going to set aside the money or do something different, that they would want to change the process to include counties. So the whole thing has been pulled, and the process has been that it's pulled unless they can get a majority of the joint finance to reinstate any of the pieces, or if people want to make separate legislation to talk about the separate pieces. That's what the plan was. So we're just following along to see once where that goes. They have had some hearings, and so we're waiting to hear. Of course, they have spent a majority of their time battling the MA expansion back and forth. So that's been a big part of their discussion. And I know that at one of their hearings, I was watching the other day, they wanted to bring up an issue, but it's so far down the line, they're trying to get these big pieces sorted out first. And so until they sort those pieces out, they're not going to be all that concerned about pieces that pertain to a lot of the ones that were for human services.
So did that also include transferring 17-year-olds back to?
That's all off the table at this point. There's no legislation
We've been
pending.
talking about that for 5 years.
We're, I think, one of only 10 counties that still has that, or 10 states that still has that. So at this point, the whole thing's off the table. I don't know if or how they plan to reintroduce any pieces of that.
as long as we're on juvenile justice, what's happening with Lincoln?
With what?
Lincoln, is it closed? I haven't heard anything. I mean,
No,
that's
it's
another
not,
thing they've
and I
been
think there
talking
was
about
some-
for years.
I'm
The
going to
regional-
have to get, there was something released on that, that it was going to continue to be open. I believe what I had heard on the radio was that they were going to keep Lincoln Hills open, oh, not on radio, at the WIXA meeting, and that they were going to, Joint Finance is looking to expand beds at the Mendota facility for some additional boys and girls, and
Great.
serve them there.
How nice. Sorry, I'm being sarcastic.
So that's the proposal that's currently on the table.
Put them in a mental hospital.
Some
when
of
they-
them, and I think I mean, they have to meet the criteria, but some of them do meet that need.
Oh, God.
Personnel report?
So for the personnel report, we have an announcement that is brand new today, and you're the first audience hearing about it, other than one person in the room. We had the posting for the deputy director up, and Erica Anderson, starting next Monday, will be our deputy director for human services.
Part-time, or is it part-time?
Pardon?
Is it still part-time?
It is 30% of her position, yeah.
Okay, so who's gonna do your job?
So we've added lead workers in her unit as well as a mental health tech in her
Okay.
unit. So we made sure that all the units were staffed adequately so that any of the unit supervisors that applied for that position would have the support
Okay.
that they could do this, so.
The addition of the lead staff is very helpful.
Okay, good job.
Congratulations, Erica. We also, the mental health tech position, we had an excellent, probably one of the best pools of candidates we've ever had. I think we interviewed about 10 or 12 people, very excellent people. We narrowed it down for second interviews to 4 people, which usually down to 2, but we narrowed it down to 4. And at the end of it, Erica and I shook our head and said, oh my gosh, all 4 could do it well.
There were at least six people in that entire group that I would have hired, like that.
Just
It
like
was
that.
So did you
really
hire
hard.
somebody?
We did, they're starting next Monday, so.
Can we know who it is?
It's a secret.
I can't remember, I would, but I can't remember their last name, and I don't have it in front of me, so,
It's Kelly Sweat.
yes, Kelly.
I don't know.
Sweat? I think that's how you pronounce it, S-W-E-T-T.
Cool.
Yep.
When does she start?
Next Monday.
Oh,
What's her
okay.
name?
Kelly Sweat.
From Osseo or?
Yes.
Okay.
Do you know her?
Well, I must be one of the Sweat Boys' wives.
Okay.
Hopefully,
deduction,
That
Bert.
makes sense.
hopefully she's not watching this on TV right now.
She will not be impressed with us. So while we had excellent candidates for that, like truly, truly excellent candidates, we have 3 social work positions that have been open and are remaining open because we have very few applicants, and the ones that we have, many of them are not even qualified for social work positions. We have the juvenile justice position for the community partnership grant. We have the dementia care specialist position, and we have Melissa Youngbauer's former position in behavioral health, working with kids with disabilities. So we're trying to expand how we recruit for that. If you have any recommendations on that, we would love to hear more. We have, for the past year, we thought during COVID we'd have a terrible response for applications, and we received so many good applications in so many of our social work positions, but these 3 just have not really drummed up a lot of business. So we continue to keep those open, and they have been posted and open until filled, so we're trying to get some good candidates in there.
I had 12 really good students in my seminar who graduate next week.
Well,
I
tell them
told
awesome
them-
things
I tell
about
them
us.
to keep looking at this job posting, but.
Yeah, we've got 3 of them, so it's
And
whatever you like
hired
to
one
do.
of our graduates from last year.
Who's that?
Heather,
Yeah, she's in the,
ADRC.
nope, she's not in the ADRC, she's in the children's unit. She was here when we had Child Abuse Prevention Day.
Okay.
Caitlin?
Maybe.
Yeah, I can't remember. So that's the personnel report. Otherwise, those, other than those 3 positions, we are fully staffed. So that's doing great. I do not have a fiscal report
You don't have a
today.
fiscal report, so
And I
then the
apologize.
next meeting is the 14th
Yes, sir.
of June.
I will not
So,
be able to be in attendance.
you what?
I won't be able to be in attendance that day. It's my son's birthday, so.
Oh, okay.
Yeah, Mr. Pilkowski.
All right. Okay, we'll adjourn at 5:50.
Oh.
Thank you so much.